Let's get on with the next talk. It's my pleasure to introduce Dr. Dane Fleidner from the Rossignol Medical Center. Please give him a warm round of applause.
We're getting tired here.
I know, right? We're all fading out. Can you hear me okay, or should I go to the loud mic? You can hear okay?
Yeah.
Okay. If you can't, can you hear me in the back? Okay, great. All right, so obviously I get the dubious distinction of closing out the day. I caught the doctors as the first lecture of the day, so when they're all still in a coma, and now I get all of you when you're all in a coma too. So lucky me. All right, but fortunately this should be, I wasn't sitting in on your previous lectures, but this should kind of be relatively light. So in a certain sense, I'm sure if your brains are like mine after listening to my side of the lecture hall, my brain is kind of hurting right now. It's kind of sizzling, so I'm sure your brains are probably sizzling as well if you're old like me. So, as we're all aware, I'm going to gloss over some. I believe the presentations or the slides are going to be available to all of you, so don't worry about the specifics. I'm pretty sure all the PowerPoints and everything are going to be available to you. I don't have to, so don't sweat the detail, don't sweat the small stuff, and it's all small stuff. All right, so, just kind of go with it. Again, this is sort of the macro view. So as we're all aware, all of you are sitting here, obviously chronic diseases are just exploding in every single way. From life expectancy, autism, and on and on and on the list goes. Things are just going through the roof. This is the most recent stuff I could find in terms of actual numbers. But we all know that things are going through the roof. Why am I opening with this? Because your doctors, and in a certain sense, part of this is to give you some info. Okay, representing Taka, very good. Your doctors, in a sense, and I'm going to act a little bit as a devil's advocate, not because I necessarily agree with it, okay, but the other part of this that Kara wanted me to really talk about is trying to help you navigate the mind of your doctor. I was going to put a slide in, I was telling them earlier, I was going to put a slide in, a quote from Sun Tzu from The Art of War that said something to the effect of, if you really want to vanquish your enemy, you have to understand them first. And I didn't do that because I didn't want that to be on paper, because I don't want, it shouldn't be an adversarial relationship, ideally, although it feels that way probably often, okay? So it's frustrating for us too that do this as well, I promise. But just to help you kind of understand their brain and then maybe how you can work around it. So in that sense, your docs are basically trained in the old model of name it, blame it, and tame it in terms of diseases, right? And then what does that yield? It yields lots of pharmaceuticals. If all you have is a hammer, all you can use are nails, right? And so that's their toolkit. So I hear all the time people saying, well, why does my doctor only drive pharma, whatever? And that's all they know, right? It's either surgical or it's pharma. They don't know about, nutrition. They don't know about supplements unless they've gone out of their way to study it, right? So in a certain sense, they're a victim and you're a victim of their ignorance. So they're also trained in the old sort of reductionistic model, which again has gotten us a lot of advances, and a lot of these super hyper specialist doctors are obviously expert on channelopathies and all this other stuff, and it's all really, really important piece of it. But the problem is that there's no glue between the silos. They're not seeing the bigger picture. And so unfortunately, the bigger picture is precisely what all of us need to give and what these kids need, because that's really the only way that things are going to get solved, rather than these little pieces, the GI doctor, the neurology doctor, the endo, the whatever. It just doesn't work, as you all are very aware. So, this is sort of the birth of what is called functional medicine. And, you guys are probably well aware of it. They hold their conferences in town on a fairly regular basis. You've got some functional medicine celebrities up in Boulder. But basically, it's upstream medicine, more or less. And what they're trying to do is individualize the therapies. So they're trying to make it personalized, predictive using, sort of biomarkers, and that's what we're going to talk about. More preventive, if your kid has got a positive ANA, let's not wait until they're in full-blown autoimmune disease before we try to figure out what's the driver. And then obviously participatory, and that's hopefully what we would want with our patients, in the sense that it is a team effort and it's not just top-down medicine. So the question that we often get asked is, well, why aren't more doctors doing this, right? And I think this slide pretty much sums up a lot of stuff in our society and in our life. You know, if you can't read it, simple but wrong to the left, complex but right on the right. And unfortunately, if you're sitting in this room, pretty much by definition, all of y'all are on the right side of that pathway, and you know, and that's unfortunately, that's the path we're all walking. But the truth of the matter is that they don't want to do it because it's hard. This is hard medicine. It would be much easier to not do this, okay? And so in that sense, I'll be honest with you, for those of you that are old enough to have seen The Matrix #1, Keanu, John, whatever his name is, you know, life in the box is easy, okay? When I was practicing regular medicine and I had A+ from United, you know, Blue Cross, Blue Shield, Cigna, I was a good boy, you know, pat. I felt really smart. I was a good doctor, I had good bedside manner, I had good grades, blah, 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 I had a waiting list, things were good. I thought I knew what the heck I was doing. And then I met all of you. And I realized I didn't know anything. And so the irony, the paradox is sometimes the more you learn, the more you realize you don't know. And the more you go down that rabbit hole, the more you find another tube down the rabbit hole, and you're like, does this thing ever end? You know? And so sometimes there's a temptation, I'll be honest, as a doctor, I mean, I don't think I would ever be able to do it, but there's a part of you, again, to use the old Matrix analogy. Remember the dinner, the bald guy that sold them out is eating the steak with the Matrix guys, and he's like, you know, I know this isn't a real steak, but I don't care. Like, just put me back in, you know? Because life was easy back then. Think about it, if you watch that movie, would you rather be in the Matrix with the cute woman in the hot red dress? I would, and then eating gruel in the spaceship with, you know, octopus alien majiggers coming and attacking me, right? And so we're all kind of out of the Matrix. The other thing too, and again, I'm not justifying, but I'm trying to give you the devil's advocate side of this puzzle. Doctors, more and more, especially newer generations, are coming in, and it is a white-collar, blue-collar job. I mean, they may as well be Teamsters, and not putting down Teamsters, but it is a punch the clock. You know, guys that go to Kaiser, it's the golden, what do they call it? Golden handcuffs, as they call it. You know, they get a great salary, they get a pension, they get 401k, they get PTO, they get great things, but they're limited to their box and they can't color outside of the lines. That's the trade-off they're willing to have, okay? And most HMO kind of based doctors have to do that as well. The other reason is that medical training is in every sense. I'm actually back in my olden days, I was an anthropology major back in my undergrad degrees, and so I studied medical culture was my sort of senior thesis, and a lot of the symbolism and a lot of the processes of medical culture as it's studying it from an anthropologic sort of perspective. And there is an incredible amount of parallel between the military and medicine. The military may be physical, medicine is mental. And I've literally had attending physicians, I went to school in New York City, med school, I've literally had attending physicians making Lee Army from Full Metal Jacket. If you haven't seen it, Pilgrim, it's a very funny movie. It's terrible, but it's funny. Anyway, I've literally had attendings making that face to interns in the presentation rooms when they did something that the attending physician perceived was not correct. Spit flying, I mean, no, I'm serious. It is not a joke. That scars you as a doctor, okay? Because the problem is that it continues on after the fact, okay? You don't want to be called, once you've joined the dark side of the team, it's very, very difficult to kind of go back. So I'll give you an interesting example. Like I do MAPS, I'm on the TACA thing, I'm talking with you, I do integrative medicine. And I used to do acute care medicine and like urgent care, and I was like, yeah, maybe I'll pick up a shift or two. I kind of miss sewing and broken bones. It's kind of fun. I'll just like pick up some shifts, a couple bucks, you know, it sounds good. I have years of urgent care and emergency medicine experience. I was on the faculty at UT Southwestern Medical School in the ER. I can't get a job at urgent care. I won't get called back. And I'm pretty sure that I'm more qualified than the yahoos that work at those places. And I really do, I'm starting to think, I'm like, I think I'm blackballed. Because they look at my CV and I think I don't get callbacks because of that. And that's serious, like I really sincerely think that. Because the first time you're like, oh, maybe they're not hiring, but after a while you're like, okay, there's something that doesn't make sense here. So docs don't want to be labeled. And then the other thing too is life is comfortable and thinking that you know what you're doing. Again, the whole talk isn't all about this, but just so I'm trying to help you understand where they're coming from. The other thing too is that there is zero financial benefit doing this, and at the end of the day, there's no financial benefit. Insurance companies, frankly, reimburse better the way that it's structured for moving the meat, right? That's what they used to say in the ED, move the meat, right? In and out, get them in, get them out, because the reimbursement is better. Sitting there for 90 minutes is not lucrative, right? If I did one toenail removal in the ER, or a dermatologist cuts off one little mole, they will earn more in that one quickie procedure than your doctors earn probably in an entire day. Even your high-paid autism doctors. Many of the companies, because if they want to continue to do this, have to drop insurance plans. There's obviously a lot of complaints about doctors don't take insurance. There's a reason they don't take insurance. They don't get reimbursed. I had to walk away from tens of thousands of dollars of unpaid AR because parents would walk away because insurance wouldn't pay me back when I'd sit for an hour and a half with their autistic kid. They wouldn't pay me, and they'd ghost. So that's not good for bottom line. And then if you're seeing an HMO physician, they're capitated. If you come in with your laundry list of all these fancy tests, and you want them to run those tests, that's going to cost their practice money, and they're going to lose their bonus, and they're not going to take their kids on vacay. So I'm not saying this is pretty, but I'm just being straight, right? Anyway, okay, enough about the doctors. Let's talk about some predispositions and sort of your side of the equation, okay? Now again, a lot of this is review, a lot of this you know, but how much of this is genetics, right? Obviously, most of you have been screened for Fragile X, and obviously there's certain little, we check this and channelopathies in these really complicated kids, but there are a lot of kids who do the genetics and really doesn't amount to much of anything, unfortunately, and you're like, great, that was useless. There are some that can be relevant. A lot of people, folate, B12, some of the breakdown of the COMT, the breakdown of some of the neurotransmitters, MTHFR, God forbid, and then glutathione creation. For those of you who are not familiar with the methylation map, this is sort of like a gigantic machine, and you can think of the MTHFR in the middle. Unfortunately, I don't think the image shows up. No, it doesn't. But it's like a big machine with various cogs in it, and the methyl cycle, or the folate cycle, is sort of the central cog. The second one over is the neurotransmitter, and this is how basically tryptophan and tyrosine become serotonin and dopamine, and then ultimately are broken down. On the right is the methionine cycle. This is where they make homocysteine and eventually goes into glutathione, and that's your kind of the godfather of the antioxidants. So, is it a huge thing? I have a lot of people, I see a lot of non-autism and non-complex kids that still want to test their kids. And, is this the sort of death sentence that I think a lot of people in popular culture have made it out to be? I don't, okay? I don't. I think it's way more complicated than that. Is it something that we keep in mind? Sure. Is it something that we kind of, when all things being equal, we're kind of going to, hey, you got a lot of COMT variants, maybe we go a little slow with the methyl B12, things of that nature? Absolutely. If you know you have a kid with MTHFR mutations, are you going to make sure that your B vitamins are the methylfolate or whatever, and not just cheapo folic acid from CVS or Costco? Yes. But is it the kind of thing like my favorite examples with MTHFR is, Angelina Jolie got her double mastectomy after her BRCA gene diagnosis a few years ago, and no offense, Angelina, if you're watching on YouTube eventually, but that's insane to me. Like, if you know you have the BRCA gene, you know you're susceptible to breast cancer, don't eat a Kentucky Fried Chicken, even though they sponsor Susan B. Komen. Get your screening done regular. They do. Don't ask me why. It's like Pepsi sponsors the American Diabetes Association too. Just saying. Anyway, so, take that information and yeah, be really, really careful, and be really on it. Absolutely, right? Don't, live near a dump or, what, not that you would, but, but don't go getting a double mastectomy and then, put a bunch of silicone in you, which is arguably worse. Anyway. For those of you who are thinking of getting a sugar daddy, don't. Okay. Older, I told you, it's the end of the day, y'all. Come on. Okay. You're still here.
Wait, are they lucky?
Oh, well, good.
Yeah.
So anyway, older dads, right? These are paternal risk factors for having kids with complex, issues, right? And that may be part of the reason why the rates are going up. Obviously, if dad works in a lot of toxic industries, painters and welders and all this other stuff, he's going to have contamination. It's going to be in his sperm. This is not rocket science, folks, right? This stuff doesn't happen out of nowhere. It's not like all of a sudden this meteorite is hitting these kids, right? But it can cause DNA alterations. It's super complicated, but grossly, it's actually not. Obviously, maternal triggers are obviously huge. We need to make sure that, and I think that's personally my sort of, and there's a lot of talk about it, but it was kind of trendy about a year or two ago, and it's just kind of fallen away, kind of thinking about going to that preconception and greening the womb before the woman ever gets pregnant. The problem is that y'all aren't thinking about that before you get pregnant. And that's the paradox. It's how do you capture these women before they get pregnant, because once they're pregnant, then I can't do anything with you, right? How do I catch you when you're fresh newlywed and you're in wed bliss, and it's like, wait for 20 years and then we'll talk, but, how do I clean you up? How do I clean up your womb? How do I clean up your dysbiosis? How do I clean up your whatever, your toxins that have accumulated, whatever it may be. It's really, really tough, right? But these are the kinds of things. So if you have family members, friends, things like that, before they get pregnant, it's like get this stuff taken care of. Go see a naturopath, go see an integrated functional MD, and get them green the womb. Again, industrial chemicals, those prenatal exposures absolutely increase the risk of diseases. And again, sometimes with these kids who the parents will spend up $1 zillion doing all these labs and everything comes back normal and they're like, great, and it's like, you sometimes wonder, is this just a prenatal hit? And, it's not necessarily an ongoing issue. But, and I'm just trying to show you, and I've also, you'll have these studies that you can bring, and you can bring to your doctors as well, and that's really key, and we'll talk about that towards the end. But basically, all of these neurotoxins and industrial chemicals can and do hurt developing fetuses. Again, we all know this, but we tend to forget about this, because we're hunting around for other things. Babies in utero are just more vulnerable to this. It just makes sense. The Pediatrics 101 is children are not little adults, right? Well, there's two things in pediatrics that we get drilled into our head, okay? One is children are not little adults, and then the second one is the mom is always right? Like in the sense that usually you listen to the mom because usually her gut is usually spot on. Except for vaccines. And you're wrong. That's another joke. It's a joke, folks. Anyway, so you would think, knowing this, that the obstetrical sort of community would be really on it and really trying to counsel, especially seeing the complex chronic disease epidemic that we're suffering right now, and counseling everybody, but they don't. Why? Because they're not educated and they don't know, okay? And unfortunately, if you don't, you can't teach what you don't know, okay? And so even pesticides are a huge factor and a risk factor for folks in terms of causing later on autism, developmental delays, and so forth. And I said this in the other one and I didn't say it here. I tend to do a lot of autism, and so I might just be habitually saying autism. Your kid may be a panda's autoimmune encephalitis kid and doesn't have autism. I'm sorry, I'm just in the habit of saying that, so just delete autism and fill in the blank of what yours, because so many of the mechanisms are identical. So I'm not to say that they're the same diagnosis, because obviously they're not, but in that regard, just out of habit, just please bear with me with that. Other things that can be, things that, mercury is another thing. And I could go on and on and on and on about all of this, but, increased seafood consumption, dental fillings with our amalgam, mercury amalgam fillings, these are the kinds of things that can definitely show up in cord blood. So, how do we treat the untreatable, right? Now, one of the things, and again, if you remember nothing else that I tell you today, one of the things that I wanted to drill, and I talked about this a little bit, we did a kind of a parent meeting yesterday as well. One of the things I think that if you haven't already gotten this and it hasn't clicked, and I think you need it to click so that you can then articulate this to your physician, okay? Because I know that you guys have a hard time, especially local folks, getting doctors to kind of be helpful advocates for you in this journey, and so then you have to travel to other places to get things done, okay? The thing you have to understand, and even when you do see a biomed doctor or some of these other functional whatever doctors, is that you've got to think of it in a slightly different way. It's the bottle is half empty or half full. It's a shift in the perception, right? It's the same bottle. We're not treating your kids' autism. We're not treating your kids' ADHD. We're not treating your kids' PDD-NOS or whatever, SPD, whatever it is. We're not doing that. That's not the intention, okay? The treatment for autism and other stuff is ABA, speech, OT, PT, and if your kid is destroying your house, Risperdal, and on it goes, right? And those are really the treatments for autism. You go see all the fancy doctors, all the fancy autism doctors, and that's pretty much like, okay, thanks for coming. Go do your ABA and whatnot, right? So what we are doing instead is trying to identify and treat underlying imbalances that then may be manifesting symptomatically, okay? Now, the reason I'm saying this is because if I had a neurotypical kid walk into the office, right, or your pediatrician that doesn't want to help you, walked into the office and the kid has migraines, the kid has constipation, the kid has allergy, the kid has whatever, no problem. The kid, you suspect a nutritional deficiency because of whatever. Okay, yeah, let's do the labs, let's do the blood, let's do the KUB, let's split up. But when your kid is autistic and doing whatever they're doing and they're looking, that's just what autistics do, right? And so why am I going to do that? There's no point, right? It's a shift in the way that they look at it and the way you are going to sell it, in a sense, to your doctor. You have to phrase it differently. Okay? You have to be, how many of you guys read Tom Sawyer Once Upon a Time? Okay? My favorite vignette in that whole darn book is where he tricks the neighborhood boys into whitewashing the fence. Do you all remember that?
Yeah.
You have to become Tom Sawyer. How did he do it? Reverse psychology, forbidden fruit, helping phrase it and frame it in such a way that the other boys perceived it as a benefit to them, right? Not to Tom. Do you understand? You've got to be smart. Okay? Not that you're not smart. You have to be sneaky. Okay? Don't hate the player, hate the game. Okay? You have to do it. All right? Because otherwise you're going to get up into a brick wall and it's not going to happen, as you have already experienced. So if what you're doing isn't working, you need to do something different. Okay? So what we're trying to do is identify those metabolic, immune, or whatever abnormalities and deal with them, and we try to figure that out by using those biomarkers, okay? And so we're going to talk about some of those therapy, or the biomarkers. So again, sort of reiterating what I was already talking about, is we are trying to treat the underlying functional imbalance, okay? Hence the name functional medicine. Okay, so where do we start? We want to start with the basics, right? Sometimes people come in, I want Sermian, and I want, some stem cells, and I want, and I'm like, how about if we do some gluten and dairy free, let's do some basics first. Let's do a CBC. What about channelopathy? How about CBC? I don't know what channelopathies are, but I know I can fix a CBC. Okay? So, sleep. Most of you guys, and again, I don't know you, so obviously I'm generalizing, don't have happy sleep times, okay? And think about it, the CIA uses sleep deprivation as a method of torture, okay? They do, well, not torture. Dick Cheney said it's not torture, so it's not, okay? Yes, it's training for residency for pediatric residents. So think about it. If your kid's not sleeping, and therefore you're not sleeping, y'all are crazy. Right? Right? I mean, and it's not, this isn't rocket science, right? It's, if I had a normal kid that came in and the mom says, my kid doesn't sleep, blah, 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 then the doc would be like, okay, yeah, like, let's figure out how we can help you and all that. But your autistic kid doesn't say, like, oh, you know, autistics. That's kind of how they roll, right? But, you know, so anyway, so, you know, not, you know, so obviously you all know this, and again, I'm just trying to kind of be thorough and certain, but not underscoring the, you know, sleep hygiene, you know, getting those kids outside, getting them off of the beep, you know, screens, getting them in the sun. You know, think about it, these kids don't go outside and exercise for the most part. They're in school all day, then they're at therapy A, then they're at therapy B, then they're at therapy C, then they come home, then it's dinner, then it's iPad until you wrestle them into bed, and they go to sleep when they go to sleep, you know, or they don't, right? So these things are important, and again, melatonin can be helpful for some kids, but we're just having a conversation. It doesn't work always for everyone, okay? So again, getting and figuring out, do you need, you know, what can you do to get that sleep done? And then there's different remedies, and that's beyond the scope of today's talk. Stress. Again, I pretty much look at anybody that has complex chronic disease children as you are all in a chronic stress state, more or less, right? And the kids especially, you know. So, you know, that kid that is waking up at 3 in the morning every day, you know, are they spiking their cortisol too soon? Instead of at 7 they're spiking it at 3. And they're wired and tired, as the old saying goes. And so guess who's also up at 3:15 in the morning? You know, not me, you know. So you're all sleep deprived, stressed out, stress buckets, right? And so you can look at that cortisol because there are things that you can do to try to help support the adrenal glands that are relatively safe and easy, right? Doesn't mean it has to be, you know, steroids or any of these sorts of things. It can be ashwagandha, it can be rhodiola, it can be all these like nice, very simple things that can just help sort of just sprinkle a little love on those adrenal glands, okay? Now, nutrition and diet, obviously a huge problem. You know, if your kid eats mac and cheese, and this is how you're going to explain and sell this to your doctor, what is going to come, okay? Please, hear me out. Your kid, for the most part, and even if they don't, you can always fudge a little bit. Most of these kids, whether you're an autistic kid, whether you're a pandas kids, they don't eat well for the most part, right? They're so picky. Chicken nuggets, French fries, and you know, mac and cheese, right? And that's it. You know, we can't get anything else down to them. I mean, I hear that all the time. And so think about it. These are kids that are at high risk of nutrient deficiencies, right? So why is your doctor going to do blood work on your kid? Not because of their autism, not because of their whatever. You're going like, look, my kid doesn't eat. He is cachectic, right? And then you couple that with all the gut issues that these guys have, and I mean, it's like the perfect storm. So how can you sort of sell this to your doctor? And it's not lying, it's true, right? But it's about the perception of why we're running tests. So I need to know, Dr. Wonderful, right, that, you know, that my kid doesn't have markers of iron deficiency, B12 deficiencies, my kid doesn't eat any B12 containing foods. My kid doesn't eat anything green, he's deficient in folate. My kid doesn't eat anything with iron, he's anemic, right? I need help so I can figure out how bad this is and if I need to supplement this. Because he has a documented deficiency in this stuff, because he doesn't eat. Help me out, okay? And then other things that you can count. I mean, just little simple things, right? If you just take a little time and tease it out a bit more. Abnormal white counts, again, can, you know, persistent, white counts can vary, but persistently abnormal white counts, you know, these can be, you know, markers for all this immune stuff that you've been, you know, gobbling up all day. Platelets for inflammation, EOs for allergies. Metabolic panels can give you clues into, again, stress hormones, metabolic dysfunction, liver inflammation. There's little things, if you read it in a little more subtle way, rather than just looking for H's and L's in the abnormal column, you can tease out a fair amount. Okay. Again, vitamin D. My place is like stone throw from Laguna Beach in Southern California. I have little like Laguna Beach junior guards who are vitamin D deficient. Makes no sense, they shouldn't be, yet they are. So how do you think your kid is, right? These are little healthy, robust, jumping off pure, crazy, tan, future skin cancer people. You know, magnesium, zinc, I mean, these are all very important things. With zinc, you know, in attention, in speech, taste, right? Zinc, if you have zinc deficiency, you don't smell well. If you've ever had a chronic sinus infection and you ate the most tasty food and it tasted like Soylent Green kind of thing, or those of you that are maybe too young for knowing what Soylent Green is, you know, kind of just mush, like just nothing. Soylent Green's an old movie where they just ground up old people and we ate them.
What?
And there's this new product called Soylent Green, which I think is super funny. Yeah, which was a very unfortunate choice. Unless they did it on purpose, which I think, yeah, you would hope, right? But still, that's literally not, I don't think that's a good marketing employee. And, yes, yeah. Ferritin levels, right? So iron storage form, right? These are going to be, if those are low, you know, insomnia. Again, maybe your kid's not sleeping well because of that. Restless legs, low IQ, poor attention. I can't tell you how many moms and dads I've gotten off their restless legs medicines because I'm like, just take some iron and some magnesium, and you know, take 2 iron and magnesium and call me in the morning, and their restless legs go away. You know, it's crazy. They're looking at me and they're like, what? Like, how did this work so easy? Why didn't my other doctor tell me about this? It's because they don't know, okay? They've just been told restless legs that you get, you know, your antidepressants, whatever they use. I don't even use it because I don't like it. Cholesterol levels, we'll test cholesterol levels because very frequently the cholesterol levels, we're looking for low levels of cholesterol because there's been studies, you know, there's you know, genetic diseases, but even just because of dietary where they have a deficiency and that can increase aggression. There's some anecdotal with vitamin A in terms of the sideways glance, although I've never really been able to find anything that really has proven that in terms of any sort of research basis. And then folate and B12 are obviously huge. And I think you guys have heard a fair amount about that with everybody today. Did Dr. Fry talk to you about cerebral folate and all that? Okay. So I'm going to just sort of skip over that a little bit because I don't want to say the same thing over and over. So you probably saw some, you know, where the folate has to go in and you give them, you know, folinic acid and they start to talk and their aggressive behaviors go down. He talked to you about all that, correct?
Yes.
Okay. B12 levels they talked to you about too?
Yeah.
Not as much? Okay, well, just quickly, you know, in addition to folate, the B12 levels also need to be adequate. Again, you think about the kids' diets. B12 is really complicated to absorb, and if you've got a pretty trashed gut and the inflammation is pretty high, you know, and you're not making intrinsic factor, and there's this 4-step process to get B12 in, you know, a lot of these kids are low in B12. Okay, and so here's a study where they're on the right, you see the autism where it was 3 times lower than kind of age-matched controls. And then this is another one looking more at the homocysteine levels and some of this sort of stuff, which is part of that little cycle where the B12 goes down in that sense. And so they've done studies where they'll put kids on methyl B12, and it, you know, sometimes we use shots. Some people, shots are a no-go. But they've even done biochemistry tests to show that that whole system starts to work better because you're giving them B12. It's, again, it's just basic. It's not really anything fancy. I mean, when you really stop and think about it. But sometimes when you bring these things to your doctor, if you bring the study to the doctor, at least that opens a dialogue, right? Versus, oh, you're just a kooky talk mom who doesn't see those quacks, and you know, and you want B12, you know. Whatever, right? So now GI issues, right? So that's, again, I think they've talked a fair amount of that. When in doubt, heal the gut is the old go back to cliche. And again, a lot of people don't want to deal with it. Not every kid has a ton of gut issues, but obviously most very often do. But dealing with that early and, you know, consistently is key. You know, if you think about it, the gut's got that tennis court size worth of surface area, and we pound on that 25 tons of food in a lifetime, apparently. I don't know how they calculated that. You know, that's a lot of data that's going into your kid's body, right? And then when you think about it, the gut, you know, this is always my little funny, you know, whatever, is, you know, when you have a donut with this, you know, the hole in the middle, you know, is the hole inside the donut or outside the donut? Right? You know, it's kind of inside, but it's kind of outside. Is the gut, are those bacteria that live in our gut, is that actually inside our body or outside? think about it. I can swallow, so you can legit swallow a string. So I'm yoga certified in India, and there's like cleansing things where you swallow like cotton and stuff. And theoretically, right, you could swallow, if you swallowed a 35-foot string, right, and just let it work its way down, maybe you could tie it to a little like a washer, right, you could floss. Right? So is that inside or outside? See, I told you, it's the end of the day. We have to have some fun with this, okay? Right? It's true though, all right, and not the kid flossing. So anyway. Yeah, exactly. So anywho, so kidding aside, so that's a lot of information. So when we think about what goes on our skin, hopefully at this point you guys are thinking about what's going on your skin as what that's absorbing in. Why is the gut different? That is the hugest interface we have with the external environment, right? If that's not working, we've got problems, right? So, and again, you're all, I'm sure, very aware of this. The gut issues are, diverse, and from the constipated to the diarrhea and everything in between, and gut imbalance. And I think most of this for you guys is certainly review. But things to think about: reflux, lactose, and again, where it goes back to your pediatrician, right? So, your kid is like super aggressive and is like having a hard time, and they don't want to eat. How do you know? And they're nonverbal. How do you know that your kid doesn't have reflux? We talked about motility, they talked about, Mido, they talked about that stuff. How do you know your kid isn't having gastroesophageal reflux? And maybe he's in pain, right? Or if you've ever been constipated, through, for whatever reason, as adults, you don't feel hungry, right? You just feel kind of ugh, and you don't want to eat. And so then you wonder, like these autistic kids that never want to eat, is it that they've learned that when I eat, I'm in pain? Right? Is it that because I'm so filled with poo-poo that I just feel ugh and I don't want to eat, right? So, why would we not treat those biologically and put the kid on an antacid? I mean, not that I love antacids, don't get me wrong. I mean, obviously there's more to it than that. But in that sense, like, what if you put the kid on Zantac and the kid wanted to eat, right? And I don't love Zantac, please understand, okay? That it's a Band-Aid, and I admit that, but at least the kid might start eating. Or if we can clean them out with something besides Miralax, then maybe they'll start to want to eat better because they're not chock full of chocolate treats. And again, kids with more severe autism tend to have more GI issues, and the more they travel together, right? The worse the GI, typically the worse the in autism in particular. Aggressive behaviors. I have moms calling me, my kid's having a pandas flare. I'm like, did they poop? Because I'll tell you what, a lot of these so-called PANDAS, and I'm not saying they never have pandas flares, please don't take it out of context. I can't tell you how many times the mom's convinced it's a pandas flare, and let's say a very long story this short, the kid is going so berserk, they end up at the children's hospital, in the ER, the x-ray is done, the kid's full of poo, they do a clean out, and suddenly, the kid's back to normal.
Been there.
Yeah. It happens.
Not my son, huh?
Yeah, right.
Yeah, my friend told me, that's even our friend. So, so not to say that it's down for pants, but, I'm always like, no, we gotta go to the gut first, go to the gut, because so often that's the driver for these guys. And you know what, I don't know about you, but if I had that belly, I would be grumpy too. Who blames them? Who blames these kids, right? I mean, that looks awful. And so, in this particular one, don't take the kid off dairy, God forbid, because there's no other way to get calcium or calories. But in this study, milk was the strongest predictor of constipation, So, that whole crazy GF-CF diet, there's reasons for it, Again, gut issues with autoimmunity and triggering autoimmunity. You guys have heard this ad nauseum today, so in the interest of just sanity, I'm going to just skip that. And again, looking at the microflora, and again, there's a lot of controversy. We're in our infancy with our understanding of the gut. One of the functional med docs put it well, and I sort of steal, actually, it's got a guy, Rob Roundtree, out in Boulder, who is a very funny speaker, by the way, if you ever have a chance to watch any of his. He's just general functional med, but he's a great speaker, so just give props to him. But he said, we are, in our understanding with probiotics and these sorts of things, where the medical community was with antibiotics in the 1950s. We really, really, are in our infancy of our understanding. We're just sort of throwing stuff, hey, penicillin cures a lot of stuff, and they're just throwing it at everything, and eventually they realize it didn't work well and things changed. And we're kind of like that. We're just sort of throwing probiotics at people, despite all the online claims from different manufacturers, oh, ours is the best, and or this or that. We don't really know what we're doing yet, collectively. I mean, not really. We're getting there. We'll hopefully be there one day, but we're not there, unfortunately. So anyway, easy gut testing. This is all stuff your regular doctor theoretically could do. If your regular doctor ain't gonna do it, you need to find a new doctor, okay? And that's why Kara's opening her Lighthouse place. Plug kind of thing. But, but these are things that are very much in the parlance of your regular physician. This isn't any wacky kind of testing that we're talking about here, okay? So, these are all things looking for microbial imbalance. And again, they're not refined enough, but it's a start, right? You can still get a fair amount. Are there white blood cells? Is your kid bleeding? Calprotectin is a marker for, inflammatory bowel disease. Elastase, does your kid need pancreatic enzymes? And your doctor could write you a prescription for Creon if your kid isn't breaking things down. Are they malabsorbing or maldigesting fats, carbohydrates, things like this? And that's why little Johnny looks like a walking skeleton, right? These are things that your doctor or some doctor should be able to do fairly easy and should be covered with your with your normal sort of health sort of stuff. Okay, immune imbalances. This has been the topic of your entire day. When I made this, I didn't know I was going to be the last speaker of the day. So I'm just going to skip this if that's okay with you all, right? Immune stuff. You guys have heard this all day long, right? So in terms of just immune dysregulation and sort of how this immune dysregulation does all the inflammation up, just throughout the body, whether that's going to be gut, whether that's brain, whether that's skin, whether that's lungs. We call those things asthma, eczema, migraines, autism, ADHD. It's just kind of inflammation at the end of the day, okay? It's oversimplified, of course, but in a way it's actually really kind of it's what it boils down to. And then again, they've talked about immune biomarkers. These are easy things that you can ask your doctor for, okay? These are screening tests. The ANA, at least theoretically, you can look, that's the anti-nuclear antibodies. Now again, there's a lot of controversy with these. Oh, well, you get a lot of false positives. It's like, well, you guys, realistically, your body shouldn't be making antibodies to the nucleus of your kid's cells. So maybe you're not going to go on an immunosuppressor or an immunomodulator for a low dose positive ANA, but it would behoove all of us to try to figure out what's driving that, whether that's gut, whether that's toxins, whether that's, whatever it may be. It's a good clue to kind of look at that. And again, for the longer term. High sensitivity CRP, again, that's just a non-specific immune kind of inflammatory marker. And then doing some allergy testing, especially if it seems clinically appropriate, right? So if your kid bonks out every time the, mountain cedar blooms or whatever, you need to think about that because, that histamine and some of those mast cells, that stuff can make a major impact on some kids. This was a study they did. This is they blasted pollens up these kids' noses, a group of ADHD kids and a group of autistic kids. And this was where the black line is the pollen counts, and then the dashed line is the regressive symptoms of the kid. This is the ADH group that didn't really respond negatively. This is the group that did, the ADHD kids. This is the group of autistics that didn't respond negatively. And this is the group of the autistics that did. Okay, so I was telling a story earlier. I have these two little boys that came in to see me. Per mom, they were future serial killers. They had a bipolar diagnosis. No, legit, like that was mom's words, not mine. And the uncle was in jail, had bipolar, and she was worried they were on the same route. I don't think he was in jail for murder, but he was in jail. And basically, very, very long story short, these kids had high histamine levels. They did not do well with histamine. We did some genetics for like the DAO enzymes and some of that stuff. went on a low histamine diet, ate a ton of antihistamine supplements, and the kids are like little angels now, and I don't ever see them anymore because they don't need me. They're doing good. You know, it's crazy. Like, you would think, like, these kids were probably a generation ago, they probably would have ended up in jail, realistically, but they're just reacting to the histamines. Again, mast cell activation is a huge topic, and I know they've talked about a lot of the immune stuff, so again, I'm going to kind of gloss over that. Pandas and pans, you guys have gotten drilled into your poor brains, I'm sure, all day long, so in the interest, but here's a nice little kind of shortcut, you know, sort of labs. Now, just my little sort of soapbox, PANS labs, especially lab titers, are really, really hard to interpret accurately, okay? As much as there's a lot of people that act as if there's like, this was the third tablet of Moses of the lab interpretation, you know, the one he dropped, if you've ever seen like the Mel Brooks, the 15 commandments, the 10 commandments, right? Have you ever seen that movie? So that was actually the IG, that was all the PANS interpretation guide that we lost, so I'm sorry. But, you know, really accurately, and I'm just saying as a doctor, like really accurately interpreting those is really, really tough. Because where do you draw those lines, right? You know, oh, I've got old, oh, my kid's got, you know, PANS because she has old HHV6 things. Well, maybe she just had roseola, but the IgG, or the IgM, the recent antibodies are normal, but we don't know how high she started. Right? And so is it a reactivation of roseola or of Coxsackie or of herpes? Maybe, but again, those just be wary of those tests because I have a lot of people that are really hot to trot for those. And I'm not saying don't do them, okay? That's not the intention. And your doctors are certainly not going to do them. Now, that much I can tell you. They won't even do a CBC, forget about it for this, okay? It's not going to happen. It's just not. But just as a little aside, they're really hard to interpret in an honest way. I wish there was better data. I have asked every MAPS doctor I can kind of corner and a functional medicine doctor that I can corner that seemed like they knew anything about this. I even bought the whole Yeshuda Schoenfeld autoimmunity and infection book, like $250, gave me no information. So it was a big waste. It's a good book, but it didn't help me. So anyway, so those are some of the labs that theoretically could be done. Mito-dysfunction, I know you guys have been just drilled, so I'm going to just blow over that if that's okay with everybody. Again, realistically, probably your general doctors are not going to want to do these labs. Certainly you can ask, but you know, carnitine, acylcarnitine, I don't know how much the other guys got in, or guys and gals got into this stuff. These are various labs that can look for mitochondrial dysfunction. Or worst case scenario, if they're just absolutely being stinkers and you want to look for it and you can't maybe go see a specialty doctor for whatever reason, you know that Mitos cheek swab is a pretty nice way to start. It's non-invasive, it's a couple $100, which is not cheap, but it's not thousands of dollars. Think about how much you spend on extra speech and ABA and all this other stuff. A couple $100 is not probably the make or breaker if you know that they've got mito dysfunction. That. And again, this is just talking about that. And then environmental toxins, right? And sort of detox. You know, we alluded to that, you know, kind of early. Things like mercury, lead, these are important things. And these are things that you can refer to and bring to regular doctors. Now, unfortunately, regular lead, blood work for lead really doesn't, you know, unless there's an active thing going on, it's really not going to probably show up too much if it's stored. Certainly the urine tests for the heavy metals are not super helpful, unfortunately, unless there's, again, an ongoing exposure to those problems. So just kind of know the limitation to that. And then, you know, again, this can do all kinds of bad things if you've got leaded, you know, water or other sort of exposures. Mercury, similarly, in terms of, you know, sort of the safety aspect of that. You know, this is the PI for the dental amalgams, and you know, you need hazmat suits to deal with it. You know, making sure your kid isn't eating tuna fish, you know, or junky salmon. You know, high order, you know, predators are high on, you know, they bioaccumulate mercury, right? So you want to try to eat low on the food chain as much as your kid will eat it. And again, a lot of these kids don't get rid of the mercury very well. You know, they may not take any more than anybody else, but they don't seem to get rid of it, and this was a study that was done that kind of showed Again, it's not the only thing. Food additives, child health, so those of us that are trying to get our husband to shop at Whole Paycheck instead of at Ralph's or King Super, my favorite supermarket name of all time here in Colorado. I think it's the most hilarious supermarket name. We don't have King Super in California. But even the AAP, who is always very, very slow to come around to this kind of stuff, talked about, they put out this policy statement a few months ago about basically safety and food safety and additives and so forth. So it's good to bring this to your doctor because your pediatricians kneel at the altar of the AAP. If the AAP says it, it must be so. Can I get an amen? Okay. Now, my favorite part of the policy statement was that they said, and I'm just going to read it because it's just so great. The current requirements for the generally recognized as safe designation of food, right, are insufficient to ensure the safety of food additives, and do not contain sufficient protections against conflict of interest. Fascinating. So those of you that still have confidence in the checks and balances of government and industry need to kind of rethink that a little bit. Additionally, the FDA does not have adequate authority to acquire the data on chemicals on the market or to reassess their safety for human health. Wait a minute. I'm pretty sure that's the FDA's job, right? Okay, I'll wait on forward. This is all available if you just put like AAP policy, food additives, you can get, honestly, it's public record kind of thing, Are you serious? This is insane, right? So, what's that?
It's not going to be fixed anytime soon.
It's not, but you can monitor what you do because the system is going to take a long time to fix. So do I love looking at my credit card bill at the end of the month? I don't. It hurts my feelings. Would it be a lot cheaper to shop at Trader Joe's and at Ralph's or whatever, or Kroger or whatever? Yeah, it would, right? But is it worth it? I'm going to pay on the front end or the back end, right? So I'd rather pay on the front end. Anyway, so pesticides, in food, the organophosphate pesticides, and again, you'll have all this, so don't worry. Diet is the primary source of this, okay? And what those things do is they inhibit the breaker downer of acetylcholine, and that's not a good thing because you need balances of neurotransmitters. Not too much, not too little. It's all Goldilocks. It has to be just right, okay? And so what that does is if you have increased acetylcholine in the synapse, that can do bad things to you. It makes the nerves not work well, and then that can cause imbalances in stuff like, serotonin, norepinephrine, dopamine, sounding familiar. And then if you couple that, your kid doesn't take enough of the amino acids, they have genetic variants, they can't make the dopamine, the serotonin, and the things. You see where you're going into perfect storms, right? So this is why it's important. Glyphosate, similar kind of thing. It's blowing up. Obviously, Steph Seneff out of MIT is doing tons and tons of research on this. And again, correlation does not equal causation. There's a similar graph of organic food intake and sort of rising rates of autism. That's an interesting graph, okay, about kind of the number of kids with autism and the increased glyphosate applied to the food supply. Let's just put it at that. If you take the pesticides out of the kid's diet, it cleans up relatively quickly. You add it back in, it goes back in. It's not super complicated, okay? Study showed it, okay? When we talk about detox and liver detox, again, a lot of people come in and they're like, my kid has got such and such an injury from some reason that we can't say, and we want to detox, right? Or whatever. And I'm like, okay, we can detox, that's fine. And they want really super exotic, they want glutathione, and they want, TRS, and nothing wrong with those things. But realistically, by supporting the enzyme, by supporting the cytochrome P450 system, that sort of on the left, you take your toxin. If you look at the guys down the middle, or on the left, you see riboflavin, niacin, just good old B vitamins. They're like the unsung heroes in this game, okay? They're key for detoxification for that phase 1 to support it. Now in the middle, you're gonna get even uglier reactive metabolites that are very, very pro-oxidant, okay? This is where vitamin A, vitamin C, vitamin E all come in, all those antioxidants, okay? And then it gets converted over, and that's where you get sort of the more exotic detox stuff you know, the glucuronidation and the transsulfuration and the, you know, glutathione and all of that to make it basically water soluble so that your body can get rid of it. Now, a lot of people want to come in and they want to detox their kid, but their kid is still full of poo. And I'm like, you can. Because even if I detox you, even if I stick an IV in your kid with glutathione and all this other stuff, and chelator, or all the other weird things that we can do, but I'm gonna shake the tree. But as I say, if you have a hornet's nest on your house, you don't figure out how to run away from the hornets to get back into your house, right? Once you've hit the hornet's nest, you want to make sure you have a clear pathway from the patio into the house, and then you squirt the hornet's nest, and then you run. Right? You don't figure it out after the fact. You got to have a clear exit strategy. And if you're trying to detox your kid, but your kid still has unsupported gut issues, mito issues, things like that, it's not going to be good. And then your kid's going to have a detox reaction. Oh, they're herxing or whatever. And it's like, no, you're doing it wrong. You shouldn't. I mean, maybe a little, but it shouldn't be like debilitating. You know. So you got to do things in the proper order sometimes. And then glutathione again is sort of the like I said, it's the godfather of antioxidants. And again, so we go back to our doctor. Why do you need these vitamins? Why do you need nutrients? If you look at the cofactors for the NADPH, right? That's from the mito. If your mito isn't working well, don't have that. FAD, again, mito, these are B vitamins. Don't have that. Well, how am I going to get my oxidized glutathione back to reduced? Reduced is like ready to take on more bad stuff, right? So I'm not going to be able to recycle it. It doesn't have to be about genetics. If I have a deficiency and I couple that with that GST deficiency from the genetics testing, the lions and tigers and bears of mine, right? Then you're going to have a problem, right? And so in that sense, that's why dealing with nutrition, dealing with the gut is so, so important early, okay? Various supplements that people will use to help support increasing the glutathione, because again, whether it's brain, oxidative stress, all this stuff, I mean, that's really kind of that common pathway. These are all things that can be helpful. Again, B12, folates are all going to be very helpful for creating that. And again, you will have the slide. You can see there's many, many downloadable. If you go to Google Images, you can find all these, like the methyl maps and all that other stuff. But when you see, you can see, okay, here's the folate cycle, here's the methionine cycle, and here's a little B12, and I need these to make this work to go down to glutathione, right? So it makes sense. It's just science. It's not complicated. Oh, it's complicated, but it's not. Pycnogenol is a very scary, weird-sounding thing. It is an antioxidant. I like this stuff a lot. It's good for a lot of kind of ADHD. Some of this stuff, it is an over-the-counter supplement. It is derived from the French maritime pine bark. Okay, if you do decide that you want to kind of go venture out and play with this stuff, please buy expensive ones. There are cheap versions of it on the market that I believe are derived from peanut shells, is what I've been told, versus like the French maritime pine bark. And so I don't know about the quality issues. It should cost you about $40 if you're going to try it. Not that like $11.99, version at Trader Joe's. Nothing against Trader Joe's, just And then neurotransmitters and endocrine. Again, POTS. I think they talked about a little bit with that sort of neuro or the dysautonomias. And again, all the various symptoms and some of the things. So having your doctor, if your kid is passing out or has fatiguing really easy or seems to really get very woozy on hot days, things like this, is something to think about. I think it's not on most of our radars. And I was certainly guilty of this until kind of moms brought it in to me, like, I think it's POTS. And I'm like, what's that? Well, because we're not taught, there's orthostatic hypotension. We learn about that in our trainings, but not necessarily POTS per se, right? And so, your pediatrician's probably never heard of it either, okay? And then there's lots of different sort of remedies depending. And then other sort of simple endocrine, yes? I will go back. I believe, again, you're going to have access to the PDFs, that's my understanding.
We'll be having it on the Lighthouse website.
Yeah, so don't worry. That's why I'm just cranking through it, because I know you're all very anxious to go home. And a lot of this has been covered, so that's the other thing. Again, endocrine biomarkers, cortisol, thyroid, looking for hypothyroidism. The thyroid takes an early a hit, you know. It's very sensitive. It's sort of, I call it the canary in the coal mine gland. It takes a hit early. So when things are out of whack, whether that's toxins or otherwise. Again, vitamin D is sort of the vitamin that is identifying as a hormone these days. That was a joke. Testosterone. And then there's neurotransmitter. Vitamin D is kind of a hormone and it's kind of a vitamin, so never mind. And then there are other biomarkers that you can get in terms of breakdown of catecholamines, so norepinephrine, epinephrine, things like that. Again, these are usually pretty specialized tests. They will often be part of other more specialty tests that you could potentially get. But I have seen a few lucky few parents who have gotten them from their doctors done. And then seizures, I know Dr. Fry talked about this ad nauseum, so I'm going to just skip that because we're already at 5 o'clock. And so in the end, so I tried to do a summary for you guys of some of the various diagnostic testing you could do, you know, in terms of basics, gut, again, you'll have this, immune, pans and pandas type stuff, tell me when I can go forward, metabolic, mitochondrial, and then various hormones and things like that, okay? And then the last thing that I just want to kind of, like a couple more slides, we're almost done, okay? You've got to understand your doctor is a human being, they're stressed out, they've got a bazillion kids to see. It doesn't happen to me often, but when it does happen, I'm always a little perplexed that someone thinks that this is a good approach. I think I'm a pretty nice guy. I think I'm pretty approachable, but I'll have people that will come in with their dukes up and take a very aggressive approach to me. And I'm not like this, and I hate to admit this, but I used to live in Texas, and there's a saying that they say in Texas that if you want to get something done, tell a Texan he can't do it, okay? So when a parent comes in and sort of is already on the attack, that does not make me want to help you out, okay? So you've got to really be careful on how you approach things, because if they feel like they're being attacked, they're going to go on the defense, and that's not what you want, okay? And I get it, you've been burned, you've probably been blown off, you're pissed off, I get all that, but you've got to be kind of full of honey. You can't be full of vinegar. It just isn't going to work, okay? You know, if you see this, you're in trouble, okay? But you also can't come in and have a huge arrogant, you know, have a big ego. You know, there's a lot of moms, you know, there are moms, you know, that are just research hounds or on Google 24/7, a lot of, not just moms, dads too. I mean, and they know so much. You have like 1 kid or 2 kids to sort of figure out. I got 3,000 that I've got to keep tabs on. Think about a big public high school. Think about every kid in your big public high school that you went to. There was like, I went to one that was about 3,000. I can't keep tabs on everything, on every kid in that school. It's impossible for me to do that. You know, you've got 2 or 1 or whatever, right? So just kind of keep that in mind. And if you go in with a huge ego and like, well, you're an idiot, you know, that's not going to get you any friends either, okay? So be firm, but be humble, right? Bring them literature. They love studies, okay? If you bring them literature, at least it'll open the conversation up. That's why I try to include some of the studies, even if I've glossed over them, because you can always go back and look at this again, and all the other docs that have given talks today, okay? And then the other thing too is please try not to sort of attack everything at once in one visit. I have moms that do this and it's overwhelming. It's like that really, really imposing guy that like, you're just like, ugh, like I can't do this, like let's just break it up, okay? Because it's overwhelming for them. And you don't want to be that, like because our moms, and you want your kid fixed, and I get it, but sometimes it's, if you try to tackle too much, you can't process all that at once, okay? And then appeal to their desire to help, okay? No one becomes a pediatrician or a family doctor to get rich, okay? We are the lowest, and I mean the lowest paid professions. I could literally make more as an electrician than as a pediatrician, and that is 100% truth, okay? So they went into it to help. It's like your kid's school teacher. They didn't become a teacher to get rich, okay? If they're still reluctant, you know, ask why. What is the reason? They're human beings. And then again, spoon feed them, right? So you don't see this, and I'm just trying to give you the opposite side of the sort of the podium, okay? I cannot tell you how many parents like, can you just fill in my IHSS form real quick? You know, to get like in-home services. You know how long that takes? That takes like 15 minutes. And I've got, 20 other emails I've got to answer, 14 other forms I've got to do. It adds hours to their day. Could you at least like fill out the name of your kid's like form and the date of birth?
Or just pre-fill it out.
Or pre-fill it out or whatever. Yeah, kind of. Right? Because if you can do that, it's like help me to help you, right? In that sense, versus like I have to sit there and I'm looking it up and I have to go back. It's like, I don't have time to do this. And neither do they. And I'm not saying that to be mean. It's their job, and it is their job. But at the same time, this is all done off the clock, And so they have to come in hours ahead of time. They don't want to do that. So if you can make it easier on them, they'll be better for you, okay? And then last, almost done, and for insurance, again, getting into the mind of your enemy. Insurance is in it for profit. They don't want to spend money on your kid. That is the end of, full stop right there, okay? If your insurance doesn't work for you, depending on obviously the economics, because insurance is insanely expensive, look at getting it, depending on what makes sense, right? A health savings account, get a health sharing, like a Christian health share plan, some of that kind of stuff. If things aren't working for you anyway, and you end up paying for out of pocket anyway, you may as well reduce your out of monthly. Cafeteria plans, if you have employers, get all that pre-tax dollars going, right? And then again, try to help bring the coding and kind of vaguely coding without doing insurance fraud. Okay, we're not advocating that, but vaguer coding, because that can sometimes be helpful. If you code it for autism, they will cover it. If it's coded for encephalitis or encephalopathy, maybe it will get covered, or metabolic abnormality or whatever. So I try to give you some like codings that you can potentially suggest that might make sense. And again, it's still true because again, we're not trying to commit any fraud or anything like that, but that will make it easier. Then hopefully then you don't get stuck with a humongous bill for all of those labs, okay? And with that, it is about 10. Well, thank you. So hopefully that wasn't too long.